Well, dozens of Hoosiers rallied outside the State House Wednesday to keep the fire burning in support of abortion rights. The rally marked the day Indiana lawmakers were supposed to meet in a special session, but that was pushed back as Republicans craft an abortion ban. Protesters say the delay was meant to quiet some of the opposition to the impending anti-abortion measure.
But it's not going to go away. We're not going to go away. We believe that women should have the right to choose what happens with their bodies.
The legislators plan to return to the State House for the special session beginning July 25th, and health officials and legal experts are waiting to see how far Indiana legislature will go.
We are about to criminalize health care. We're about to criminalize women. That's not too difficult to figure out.
Tippecanoe County Health Officer Dr. Leg Loomis says an abortion ban in the state will have clear negative impacts on health care, particularly on fetal infant mortality. He says even if the legislature allows exceptions to protect the life of a mother, there'll be complications.
That's tying doctors' hands. You know, it's taking medical decision-making out of doctors and nurses and pharmacists' hands and tying them up because of a political ideology.
The National Right to Life Committee, one of the oldest anti-abortion groups in the country, has proposed a model abortion law for states to adopt that would include prosecuting those who perform or aid in abortions. We're joined now by Terre Haute-based attorney James Bopp Jr., the general counsel for the National Right to Life Committee. Welcome to the show.
Thank you.
So the NRLC is proposing a post-Roe model abortion law for states to adopt. Briefly, what does that model look like?
Well, now that the Supreme Court has correctly noted that there's no constitutional right to abortion, that means that states are free to adopt their own public policy regarding protecting unborn life. The Right to Life movement believes that abortions should be limited to only preventing the death of the mother. It is certainly a pro-life position to have exceptions for rape and incest with proper safeguards, and we have proposed those. We believe that women should not be penalized in any way for abortion. We have, had, before Roe v. Wade, we had almost 150 years where abortion was illegal in the United States except to save the life of the mother. And no woman was ever prosecuted, nor has any law since then penalized the woman. So that's the basic substance of the law.
So how far do you expect Indiana's abortion law to go when they meet in special session later this month? What are you hearing?
I don't know. Of course, we all know they're working on an appropriate legislation that will meet their policy views, but I don't know what they will do.
Mm-hmm. So what do you say to medical professionals who see abortion restrictions as, government interference and that doctor-patient relationship?
Well, I'm very distressed that they think killing one of their patients is just simply some routine matter that they ought to be able to decide to do. An unborn life from conception is an individual human being and entitled to, under the Judeo-Christian ethic and certainly American law, to full legal protection as a person. Now, abortion can be justified, as I've explained, and I think is a moral imperative if the woman's life is in danger. But this is not just simply a matter of physicians deciding on medical treatment. This is physicians deciding on killing a patient. And that is not something that physicians should be allowed to do.
Are you anticipating prosecutors, DAs will try to avoid charging persons who get abortions or doctors who perform them?
We already have, the Marion County prosecutor has already announced that he will not enforce any criminal abortion laws in Indiana once they are passed. As a result, the model law it takes that into account and provides civil remedies, injunctions, recommends that other people be given the authority to bring criminal charges, such as the Attorney General. These are lawless, radical Democrat prosecutors who are using their discretion to decide what the law is in their county. They're not the king. That's the job of the legislature, not the prosecutor. And the model law deals with that by providing additional remedies.
We just have 30 seconds left, so very quickly, it's been a 50-year effort to overturn Roe. What's next for the pro-life movement?
Well, not only restoring legal protection to the unborn, but also providing the services, the support, the help that really is going to be necessary for women who face a crisis pregnancy and now will be giving birth to their child. Both parts of that equation need to be very seriously addressed, and I hope and I expect the legislature in Indiana to do that.
All right, we have to leave it there. Thank you very much for your time. Appreciate it.